just want to thank you for taking time out of your busy schedule as an educator to join me tonight. Got a special guest I'm looking forward. I'll introduce in just a few minutes. But as I look at the new year, that what I love about the new year, like every new day, it's a new year and it's a new beginning. And for many of us last year with the pandemic, we were in crisis mode. Our hair was on fire for literally the entire year. And yes, there's still challenges that are in front of us. But really, my heart for each of you is I'd like you to think about something and write this down. Is that, we talk about New Year's resolutions, which is really more of I'm not going to do this, but I'm going to do this instead. That has no power to inspire you and to propel you through the difficulties of any year as a nurse educator. And I really want to encourage you as an educator to think about vision. What is your vision for nursing education, for what you do? I think that oftentimes as nurse educators, we don't see the value of what we do, that we are inspiring, we are preparing, we are forming the next generation of professional nurses. Just like a mother who's home taking care of her child, rocking that cradle, in reality, all by herself, unsung, unseen, the hand that rocks the cradle rules the world. And in the same way as nurse educators, we have an influence. And I want to give you just permission to dream, to get a vision for what nursing education could be like in your program, a vision to engage students, to inspire them to be the best, to pursue excellence, and kind of what that would look like in your program. And I would just give you, I'd love to know, for those of you that maybe have thought about this, if you have a vision statement that you want to be, or that you want your program and your students to aspire to, throw it in the chat. I'd love to see it and really encourage other educators who are checking this out tonight to really be inspired as well. And so, as you look at who I am, my name is Keith, and I'm the CEO of Keith RN. And what I do with my website and the resources that I've developed is really my vision that I have for nursing education is to close the academic practice gap once and for all. The gap between how nursing is taught and how it's actually practiced is way too big. And there are practical strategies that we can do, embracing educational best practices that I've developed, innovated, as well as, more importantly, built on the work of our scholars of our generation, Dr. Pat Benner and Chris Tanner, and her clinical judgment model. And so I just want you to know that I am there. I got your back to really strengthen and to give and to support your vision to transform how you teach in your program. And so if you're checking this out for the first time, really my goal, in addition to closing the gap, is really to serve your needs as nurse educators, to kind of provide you with kind of a next step. So, you have a vision to dream as an educator, but yet what are those practical steps you need to do to change? Because change comes difficult in nursing education. And there's many things that are working against us. And it's like my goal and my passion to really help every educator do what they can do to better prepare their students for both practice as well as licensure. And so I have numerous topics on my Facebook page, Keith RN, Think Like a Nurse. And every Facebook Live that we've done, which is really in reality like a little mini webinar at no cost, is on my Facebook page under videos. And I've got, at least 15 plus topics that you can look at and review, as well as this link from tonight. If you're unable to make it or a colleague was unable to, please go to my Facebook page, Keith RN, Think Like a Nurse, and that will be waiting for you there. And so just want you to know that you've got that for you. But I want to introduce my guest tonight, and I'm pleased to introduce an experienced educator with 40 years of experience in nursing as well as in nursing education. And her name is Dr. Susan Jetton. She earned her DNP from Western University in Pomona, California, beginning her 40th year as a registered nurse, with most of her career spent in maternal child health, administration, and nursing education. She's a professor of nursing, teaching perinatal nursing at California Baptist University, and as one of those innovative educators who's been thinking outside the box before things like simulation came of age in the 2000s, 2010s. She was in the 1990s, was already developing some strategies, working in that realm. And she also has a vision that says this, that students will rise to the level of the expectation, and that faculty need to be willing to climb outside the box and try new and innovative ways of teaching. And so I'm just blessed because Dr. Jetton is kind of a kindred spirit in many ways, because we share that same vision of really innovating to transform and to strengthen how nursing is taught. And so I just want to bring Dr. Jetton into our conversation tonight. I want to thank you for coming on and joining us today. How are you doing tonight? You're out in California. I'm in Minnesota. We're a little bit warmer. I hope you're doing well.
Oh, we have much better weather out here than you do.
I know you do. I know you do.
Yes,
great to have
it's
you
great.
With us, Jetton. And I just,
thank you.
I just like to always, every one of us as educators has a journey. And, I just would love to know just briefly your story as far as what interested you in nursing. And then you made that transition to nursing education relatively soon. And so just give us your thumbnail as far as just kind of what that looked like 40 plus years ago.
Well, actually, I don't really know exactly what motivated me to want to go into the medical field, other than I love to watch a show called Medical Center, which many of you probably would not even remember. It was on in the early 70s. But while I was still in high school, I was actually a nurse's aide in a nursing home. And then I graduated early from high school and went straight into a medical assisting program. And knew I wanted to do more, but I was working at a facility that was paying really well, and the benefits had 100% medical. And at that time, it was very difficult to get into nursing programs. And nurses were actually starting out at only 50 cents an hour more than I was making. And so I had no motivation to go on at the time. But then a family friend of mine was dying of cancer. And the last time I saw her, she asked me to make a promise. And she wouldn't tell me what it was. And I said, well, why won't you tell me? And she said, I know this is something that you want, and I wouldn't ask you to do it if I didn't know you wanted this. But she said, will you promise me you will do something for me? And I said, well, I'll do anything for you, Flo. And she said, I want you to become a nurse. We need more Christian nurses. And so with that, she passed away. That was the last time I saw her. And I honored that promise. I went back to school. And today I'm actually preparing the next generations of Christian nurses at California Baptist University, and I've been there for 14 years now. So, it's amazing how things worked out. I would never have dreamed I would have been in education at that point. But I started out working, and my first husband was actually followed me into nursing. And years ago, believe it or not, if you had 4 years of experience, you could teach. And what they considered 4 years of experience was 2 years of education, so an ASM, and 2 years of work experience. Okay. And he was in a program, and they were short on a pediatric instructor. And I worked pediatric intensive care, and had just switched over to OB. I think I have 3 years of it in peds instructing. And he said, well, my wife's got peds experience. And they said, have her come talk to us.
Okay.
And that's how I ended up with my first year of education. Didn't do any more for a number of years after that. Realized how poor I was at education, although my students got a phenomenal experience because I was teaching at the hospital that I was working at, and I knew all the residents and interns. So every post-conference was done by a resident or an intern, because I knew I didn't know how to teach. but I did know how to recruit them.
So how did you make that transition? Because one of the challenges, Susan, that I think a lot of us as educators struggle is that just like our students struggle to transition to real world practice from education, educators who are moving into that role for the first or for that first time are expert nurses, but teaching is a whole different animal. And so it's like, what did you learn in your journey to, the school of hard knocks applies to all of us, but it's like, what were the pearls that you learned in that journey, and what really strengthened you to really be, an innovator in academia?
Well, I think what that first year did for me was realize that I needed to learn how to teach. And so when I went, there was a number, like I said, there was a couple decades there between going back into practice and then back into teaching. And so when I decided to go on, obviously at that point I only had my ASN, went on and got my bachelor's. But by the time I started my master's program, I knew I wanted to go into teaching. And at that point, because I wanted to teach, I knew I wanted to do it, my master's in nursing education. I honestly realized that I needed that educational background to be able to be a good teacher. The other thing is, even when I did my DNP, I did it with the emphasis on teaching, and I took extra educational courses. The other thing I have done is I have continued to take multiple educational courses. I think another thing that has really helped me is I adopted 3 daughters, all having learning disabilities, and having to adapt styles for each and every one of them individually to help them learn has helped me to teach students in multiple different levels and different ways. So that has helped me tremendously, and to be able to look at different ways of doing things rather than just, one size fits all type of a thing.
And if you're to look at, condensing just some of the big picture principles, Susan, you mentioned some books about the 7 laws of teaching and learning, books that you've read and other resources. I mean, I would like just to spend just a moment, if you could, I want to give those educators that are listening today enough information that they could take some meaningful step or two to strengthen their pedagogy and practice as educators, in addition to some practical strategies, because we have to have the big picture, theory and best practices, then distill that into the nitty-gritty of what we do as nurses. And so if you've got a pearl or two of just from that educational background that you found most effective and meaningful, I'd love to hear it.
Well, like I had shared with you before, my philosophy of nursing actually has come from Howard Hendricks, who book, 7 Laws of Teaching, which actually came from an earlier author, which is this one, John Milton Gregory. Now, let's see, where's my camera here?
There you go.
Yeah, John Milton Gregory. And this was actually written in the 1800s.
Okay.
And these laws have not changed. And basically they are, it's amazing. They are so simplistic, and yet they're things that,
well, give us one or two. Give us one or two, and how you as a nurse educator made it practical.
Well, okay. So the first one, one of the ones here would be that we as an instructor, we have to, I'll summarize them, but we have to be able to motivate our students to want to learn.
Yeah.
And so teaching OB, for instance, I have a lot of students that come into it thinking, why in the heck do I need to take this? Especially my male students.
Yeah.
So right from the onset, I have to motivate them to want to know. Why do you need to know this information?
Yeah. Excellent. Okay.
So I start out. You may not have children yet. In the future, you'll get married, and your wife is going to get pregnant. You are going to want to know how to have her have a healthy pregnancy and what she can do so that you can have a healthy baby. Most guys go to work in ICU and ED. Sometimes the patient doesn't make it to the OB department. Sometimes you deliver in the parking lot.
Yep.
Patients that are pregnant get in car accidents. They end up in the ICU.
Right. That's right.
By the time I get done with them, they see the picture.
Excellent. Excellent.
Another one of these would be that learning is thinking into one's own understanding, a new idea or truth, or working into habit, a new art and skill. I mean, that's exactly kind of what we're talking about with these case studies. You know, they have to take the information and work with it and have it become part of what they're doing, and to develop those skills and make it part of who they are, not just be spoon-fed the information.
Kind of like
I like
that formation of professional identity.
Exactly. He talks about reviewing, rethinking, reknowing, reproducing, and applying the information. And I'm very big on that. I like to call myself a Socratic instructor. I obviously will give information at the beginning of my course because they don't know much. But by the time I get into the high risk OB, I'm constantly going back. You know, why is this happening? You know, what would you see on the monitor when this condition is going on? Well, why would you be seeing that on the monitor? And especially, like, for instance, when we are doing online teaching, I realized that the way that I teach didn't take a lot of adapting. In fact, in some ways it was easier for me because I have a hard time memorizing a lot of my students' names. And this way I had all of their names on the screen.
Yep, they're all right there.
And so I could immediately go to their name and say, okay, Joe, you know, what is XYZ, or, you know, so on and so forth. And it held their attention because they never knew when I was going to be calling on them.
That's right. So how did you bring, you know, one of the challenges I think most educators have, Susan, is that they struggle to really engage their students in the virtual learning environments, whether it be the classroom or the virtual clinical space. And so what I'd love to distill and to kind of deconstruct and break down here is, what did you do to really just kind of still bring the essence of who you are, how you teach, the Socratic method of just using simple questions like one word, why, and really engage your students in that process? What is that? How did that look like practically? That's maybe big picture. That's not just for maternal OB and infant, but could be those principles that could be distilled for any educator, that they could walk away from this webinar, from this Facebook Live, with just some big picture principles that you really found helpful, that they could benefit from.
Well, one of the first things that happened was the first semester, or the very first lectures that I was doing online, I would pull up PowerPoints. And I would see like the small little thumbprints of my students on the side, and I'd only see like 3 or 4 of the students, and that bugged me. Right. I couldn't see my class. Yeah. And then I tried the next week putting them on the side screen, but then I was constantly looking like this, and my students were in front of me, and that bothered me. Yeah. So I decided, okay, fine. I'm printing off my PowerPoints, and I'll have them in front of me, which I usually use mostly as guides anyway. I'm not one to sit there and read PowerPoints. Yeah. And so I had my PowerPoints in front of me. I switched from WebEx to Zoom because they were able to pull their own PowerPoints up on that format and still see me. And that way I had my entire class in front of me. So that made me more comfortable to begin with.
Yep, you could see everybody. You could, and you expected
I could see them all
on the Zoom screen. You didn't you didn't accept any of this, you know, names or a photograph.
Right. That was one of my things. It was like, oh, if you're going to be present, you are going to have if you want to be marked present for the course, then you need to be visible to me. Yep. And you need to be participating. And it was hard because they actually had a 3-hour course right before mine. And then my course was 3 hours. So it was hard for them to be on. I mean,
Right.
we don't like to be on online for 6 hours.
Yeah.
So I had to do things to keep them attentive. And so I had to change things around quite often. So, you know, I would maybe do some lecturing for a little bit. And like I say, I do the Socratic Method a lot with, you know, calling on them and applying things. I'll throw in some NCLEX questions frequently. I will put them in a Zoom room and have them maybe talk about the muddiest point or something and then come back. I might put them in a room and say, give each one of them a small segment of what we're going to be talking about next, and have them come back and share something that they've learned about that, or the answer to a question that I had regarding that. Sometimes I'll throw them in a room and say, okay, come up with an IS bar on that you would give regarding the topic that we just spoke about. You know, we just talked about, you know, a patient that, you know, with all these signs and symptoms and so on and so forth. If you were going to call the doctor, what would you say? Yeah. And so just, you know, a lot of different breakout points and things like that. One of the things that they sometimes really enjoy doing is creating their own study guides. Okay. So sometimes what I will do is I will have them go into a breakout group and create a PowerPoint. And it will be on, I'll give them each a different topic in the different breakout groups, and they can go back through their notes, and they will do a PowerPoint where the question will be on one slide and the answer will be on the next, and then they all email them to me, and I combine them after checking for correctness. Okay. And then I send it back to them so they can use it as a study guide. Okay.
So like you identified the questions from the content, and then they would develop the PowerPoint that would address.
No, they develop the questions and the answers.
Okay.
So I just give them the topics from those PowerPoints.
Excellent.
So we've already talked.
Yeah.
And it's just another way of review.
Okay.
So I believe in them having to deal with the material in multiple different ways. And you know, one of the studies that I had read was if a student engages with material once in one way, they will retain about 10% of it in 30 days. But if they engage with the material in 6 different ways, okay, 6 times, they can retain up to 90% in 30 days. Okay. And I emphasize that to my students over and over again.
So if you're going to break that down then, Susan, into basically maybe 3 or 4 different ways then, and then I'd like to get into how maybe Keith RN case studies that kind of fit into that pedagogy of sequences. But I'd love to just kind of break that down just a little bit so that educators who are watching this can basically kind of get a vision of just kind of what some of those interaction points can look like, of different ways of engaging with the content. Any thoughts on that?
What do you mean by breaking it down?
Well, like just those 6 different ways of engaging with, like, seeing it, whether they read it.
Okay, they can read their textbook. They, you know, they can review it by making questions.
Yep, which is what the
going back through it and making those PowerPoint things. Yep. They can, one of the things that I encourage my students to do, especially those that are struggling, is to find a partner and to meet very closely after the lecture time or after the class time. And I will tell them to find a partner, it could be online, and take their notes, and I will teach you a page. And then you will question me about that page. Then you will teach me the next page and I will question you about it. That way, if they run into any problems where they don't understand something, maybe the other person does, or they can look it up together and maybe figure it out together, or they can call me and ask me. Yeah. And then they've reviewed it right after that. Another thing I have created for my students is, because if you don't have a knowledge base, you can't do application analysis.
That's right. That's right. And that's why they must understand the essential content that we're teaching them and really
Right.
simplify it and
So
bring it.
another thing that I have created for my students is audios. And I created these because I actually teach entry-level master students that are on a fast track. And so they are taking quite a few extra classes at the same time.
Mhm.
And so I knew that time was of the essence for them. And so what I did is I created audios where I would take the material and I would ask a question, leave it like a 6-second space of time, and then I would answer the question. And then I would continue to do that all along. And this was something that I actually did for myself when I was in my bachelor's program, because I was working as a nurse at the same time as I was going through my bachelor's. So time was tight for me at that time also. And so anyway, it's, I'll hear these, in fact, it was funny one time because my daughter was a student at CBU and she had dropped me off at the nursing building and went to park. And she heard my voice and she's like, wait a second, I just dropped my mother off at the other building. And she was listening, she heard the students playing these tapes.
Okay. And so
But they,
it's like a study guide for students that they would stop it and they would reflect and see if they knew the answer or look for the answer before they heard you explain it.
right.
Okay.
And I really don't explain it. I just give the answer.
Right.
It's just strictly for knowledge base.
Excellent. Excellent.
So that's another way they can do it. Another way would be, so we've got reading, we've got listening to the lecture, we've got, reviewing it, reviewing over the notes again, reading them out, notes out loud. Some of them will do flashcards. Some of them will review the flashcards that they make. So just lots of different ways that we apply it.
What about the case studies? Did you use those more in the classroom or more in the clinical setting, Susan?
Now, I actually use them more in the clinical setting.
Okay, let's
I
talk
have
about
used
that then.
I have used them in the classroom, but to be honest with you, the students actually like it better in the clinical setting
Okay.
because when I used them in the classroom, it was a homework assignment,
Okay.
and then they did a presentation in the classroom, and they felt it took away from other things that they would rather be doing in the classroom.
Right.
So how I'm using them more often than not in the clinical setting is as a, I use them when there's downtime, which unfortunately happens a lot in OB. My clinical group is 10 students, and we don't always have that many patients in the clinical, area for all of them to have a patient. And so what I'll end up doing is I will assign them the different case studies, and I usually will use the skinny case studies.
Skinny reasoning is the shortest. It's only
Skinny
like
reasoning.
12 pages, and it's pretty concise, but yet captures the essence of a pretty full, the range of knowledge a student needs to know.
Exactly. And then what I do with those is I have them do the full case study.
Okay.
And then I have them present during post-conference on their case study.
Yep.
But I also will have them, especially if they do not end up getting a patient during the day. A lot of times they will. But if they don't get a patient during the day, then I'll have them do some of their other assignments using that case study. So like we do focus notes.
Yep. And
And so I will have them do a focus note on the patient that they did their case study on.
Okay.
We also do the patient care note or patient care forms, and which kind of involves, what. Actually, I actually use a lot of your clinical reasoning questions on there,
Okay.
and so they will have to answer those questions based on the case study, in addition to the ones that were already on the case study.
Okay.
Yeah, so it's like a clinical prep tool. So they'll answer that based on the case study.
And what I like what you're doing, Susan, that's really unique that I've not heard a lot of, is that you're taking the foundation of the case study and then integrating some of the clinical aspects in your setting, like doing the notes and other aspects of just making it more like a patient care experience when there's no patients. And so even though it's really just a writable PDF document that you can print up when you purchase it on my website or have the membership that I do believe your program has, and you have access to 110 topics across the curriculum, you can kind of choose what you want, but it's relatively low tech. But did your students find it valuable and a high learning experience? What was their
They
feedback?
do. Overall, I get feedback from my students constantly. Anytime we've tried, what's that?
Good and bad. You get both. It's never always. It's kind of a.
No, I do. I ask anytime we start something new, anytime we do anything different, I'll ask for their feedback, and I let them know that I will make changes, and they know I do.
Yep.
Based on what they say.
We have to be flexible, especially we can try new things, but we still got to get the feedback and then digest it to see, is that a legitimate complaint, or are they just being lazy, or just not quite as, they just wanting to be passive learners and not active learners. And that's
right. And I mean, there are some things I'll have students, I want more detailed test plans. And I'll say, wait a second. What kind of a nurse would you want caring for you or your family members?
Yeah.
The ones that took a test based on a detailed test plan, or the ones that really knew the material and knew how to care for you? Yeah. But no, they tend to really give good feedback when they know that you're sincere and you care about what they're wanting. And we've made some awesome changes to our curriculum based on student input, and it's been great. But anyway, the students have had nothing but good things to say regarding the assignments with the case studies, and they have had some difficulty with some of the clinical reasoning questions. And part of that, I think, is just that they have a hard time coming up with, thinking through things. I mean, this is a generation that doesn't want to critically think or think very deeply.
Right. And, those questions are really at the application analysis level and really are kind of grounded in Tanner's framework of clinical reasoning or clinical judgment, and really getting that what is relevant in this scenario and why. There's that Socratic aspect in the case study. It's all open-ended. There's no multiple choice or guessing for the students. So it really replicates in a very simple way, how students need to think in the real world setting.
Right.
I'm just kind of curious, are there other tools or resources that your program's using inside the departmental membership that they're finding? I've got other handouts on clinical handouts, etc. I'm just curious, is there other besides the case studies that you're using in the program, or is there anything else that you're finding helpful?
Well, one of the things that we have adopted is the Think Like a Nurse textbook.
Okay.
Or as a textbook. And we started it, I believe, 3 years ago, because now I think it's integrated throughout the program. And it's made it all the way, because our nursing program it's a bachelor's program, but the students don't enter it until the sophomore year. Freshman is pre-nursing.
Yep.
And so what we have done with that is every semester, it has been divided up among each course. So each class basically is responsible for certain chapters. And each class is free to kind of decide how they want to implement that. I know for our course, we have critical thinking, and then the pediatrics has the clinical reasoning. And what we have done is we have come up with a written assignment that basically is kind of knowledge-based for the first 15 questions or so, where it just proves that they've read the book and or, they answer questions. But then the last ones, they actually have to take all of those clinical reasoning questions and the habits, and there's questions about application of habits. And then the last question actually relates to knowing that you are going to be this novice when you start. How is that going to influence you when you very first start, your first year of nursing, or how will that make a difference in your thinking that first year? And it requires them to basically critically think the answers to those questions and to write those out.
And one of the goals that when I wrote my student textbook, and I have a copy right here, it's Think Like a Nurse, Practical Prep for Professional Practice. And it's in its second edition, going into its third edition. I'm rewriting it as I speak. It's quite a work in progress, using a lot of my knowledge from my PhD and other latest research, especially with the next generation NCLEX. But one of the things that I really wanted to do with that book was really make clinical reasoning practical for students, and so that we can break it down. And I've got a couple questions here, Susan, I think you might recognize from chapter 8 that your program is that I want the students to make these connections of patterns that, one of the things that they're going to see on the next gen NCLEX, as well as in practice, they've got to connect the dots and put the pieces together of the clinical setting. So these are questions that are kind of highlighted in the textbook in chapter 8. But more importantly, I want you as educators who are watching to write these down, because these need to be in your clinical paperwork or in some form that you are asking these questions, helping your students make connections of data, one of those being the relationship of medications to their past medical history, or looking at the relationship or pattern between what's relevant of clinical data and the primary problem. They come in with this problem and they've got these labs that are altered, these vital signs that are altered, assessment. How do those relate? The physiology and that information. And I have one more relationship of the orders that the care provider orders and the primary problem. What's that connection or relationship? And I think you're using some of those questions already, aren't you, Susan? Or at least incorporating.
I think I'm using all of those.
Yeah.
Mm-hmm.
As a practicing nurse, that's what I kind of just, internalized those, but I just made it practical so that we could help our students kind of make visible the invisible thinking that an expert nurse uses in practice. A couple things just in closing, Susan, is that you've been using the membership and the tools for a couple of years. There was a chance to renew that discussion and say, do we want this membership to continue, and the resources? And what was the overall opinion in your program with faculty and the use in your curriculum? Is it something that they want to continue? And if so, what are your faculty valuing with the tools inside?
It was definitely something that they wanted to continue. We discussed it at our last program review. We are using multiple different learning resources, and one of the concerns was that we have so many, which ones should we let go, because we can't make use of everything, and sometimes you get so overloaded with different materials. But this was one that the faculty wanted to hold on to. They were definitely invested in it. A lot of the faculty use it in class as in-class activities. A lot of them will do it as part of their class time as a group activity where it's being led by the instructor. A lot of them will use it as homework assignments, as pre-assignments. Some are using it as preclinical assignments. Some are using it as things that they can use prior to, or not prior to, but when we have on simulation days, there's downtime where students are waiting to go in and actually do their simulation. And some of them will be working on case studies while they're waiting for their time. And then during the debriefing time for their actual simulations, they will also go over the case studies. So they're using it in multiple different ways. I know one of the ways that I want to use it in the future is I have an assignment where I actually have students. I've created unfolding case studies where I only give the diagnoses and a very short synopsis of what the patient is, but the student actually gets to develop the case study themselves. And I didn't realize until recently that you had that blank template that they could use to do that on. And I think that would make that much more helpful for the students to use. And so I think I'm going to start using that in the future too.
Excellent. Excellent, Susan. And so, yeah, it's called a reverse case study. You can Google that in the literature of nursing and just Google search it. But in essence, you have a template inside the membership that just simply allows you, it's the same format of like my skinny reasoning, which is my shortest version, that you can simply then assign that document and the students can easily create it, and just makes that exercise, and even as a virtual clinical activity, they can create a case study based on the topic that you assign as well. So you can kind of have the students either do a case study or they create a case study, go straight to the top of Bloom's. And so,
yeah, if I had more time, I would love to go into detail on creating case studies,
we'll
and creating high-risk scenarios. In fact, I'm actually working on a book right now for student-led high-risk scenarios, and the students love it. And they learn on so many levels when they create.
Yeah, and what you're doing with any case-based approach, whether it be like that high-risk scenarios or just a simple case study, is that you're really just bringing practice back into a practice-based profession of teaching. We're applying the content, not just teaching the content. And that's really, I think, the missing link that we need to strengthen as nurse educators. And I think case studies are one approach, but I think they're foundational. Anything that brings practice into our programs is always a win-win. So yeah, I think that's a great strategy, Susan. We'll talk about that again another time.
Mm-hmm.
In closing, give me one or two pearls. You've been an educator for a lot of years. If you're just to step back, especially as we look at the current dynamics of virtual teaching, education in general, the struggles that many educators are experiencing in numerous, in class and clinical, just what does that look like? If you give us one or two of your best pearls, what would that be in closing?
Wow, that would be tough. Well, one thing that I have definitely loved about being in the university that I'm at is the fact that we have the freedom to try new things. I mean, I've been at other places and it was almost like pulling teeth to do anything new. And so I would say if you are in that type of situation and you want to grow, you might need to look at other places that are going to give you the freedom to do that. But don't be afraid to try new things. Don't be afraid to get outside of the box and try something. And if you fail, okay, you learned. It didn't work.
Or you modify. You don't necessarily go back to square one. You just say, okay, that didn't work the way I expected. But now how can I modify it, get some good feedback to then basically just, stay the course of innovation and change, just continue to just, modify it to make it better.
Exactly. And then I would say believe in your students too. Believe that they can succeed. I honestly believe that they've made it through all their prerequisites. And they've made it that far. Find out what's going on in the ones that are struggling and work with them individually. A lot of times, when I've talked one-on-one with students, occasionally it's been that they've been forced into nursing by their parents or something, and they really don't want it. And sometimes I've, encouraged them that maybe this isn't what you want to do, and you need to make that step and get out of it while you can, and not spend all the money that you're in time and investment. And I've had students come back to me later, and they've gone into other majors, and they have just thanked me for that type of advice. But for those that really want nursing, work with them. Find the resources to help them be successful. And usually they will. And like I said, that might mean using counseling services to help them with test taking anxiety. It might mean, sending them over to academic success centers or whatever else that your university has. Or it might even be, there have been times where I've actually had to help students access student services for housing because they were living in their cars. But without asking those questions, you'll never find that out. So that's one of the things that I think is really important, is to get involved, know your students, and really care for those students. Yeah. Another thing that I would say as a pearl for teaching is don't quit learning yourself. I mean, I took so many online courses, this summer, to learn how to teach online. Yeah. Because I had never really taught online before. And so, but I have, even though I did my master's in nursing education, and I have taken so many different educational CEU courses, contemporary forums, Elsevier, Office Excellent classes. Every time they were on the West Coast, I would go. They'd alternate between the two places. Simulation classes. Keep yourself updated. Amen. And know your material well.
Yeah. Simple stuff, but it's easier said than done. And it takes a lot of work and effort. But it's like, I think as educators, Susan, we need to desire to be excellent. And it's we just got to struggle. We got to make that a priority to find the time to develop ourselves as we can to be the best for our students and to be that role model. And so, yeah, I think that's great feedback. And thank you so much for sharing.
Yeah. Oh, and another thing I would say is get yourself on some of these sites where they'll send you the briefs, like ANA briefs, and I know I get some from A1, I get some from neonatal briefs. So what they do is they send you updated topics on latest research, and then if you want more information, you can click on it and get the full article information. And that's a very fast way to keep updated on new research.
Excellent. In your topics that you teach, and just stay focused on those threads and go from there. Mm-hmm. Excellent. Well, listen, I'm going to basically just take a moment to just kind of share some thoughts, and then we're going to bring you back. So if you have some questions, I'm going to just take you off here, Dr. Jetton, for just a moment or two, and then we'll want you to think about some questions you might have. But I just want to let you know that, my passion is to support your needs in nursing education. One of the resources I have that Dr. Jetton mentioned was the student textbook, Think Like a Nurse. And I'm in the 3rd edition now, and it's really going to be focusing on developing clinical judgment, how to do that well with next-gen NCLEX, as well as just really the practice demands that our students require in the 3rd edition coming later this year. So if you'd like an ebook of the current edition as kind of a faculty preview, I'd love to send that to you. All you need to do is just email me at keith@keithrn.com. And I'd be glad to get that to you and just give you a kind of a preview of what the essence of it is currently and how you could use it to strengthen student learning as a required or a supplemental resource in your program. I also want to let you know that I also have a free website on my website, keithrn.com, on COVID-19. So if you're looking for just a case-based, want to just sample, like a Costco ample sample, and see what a clinical reasoning, skinny reasoning, the shortest level that I've developed looks like, go to the website, download it, and take a look. Comes with a fully developed student version with open-ended questions, 4 pages in length, and then a fully developed answer key for faculty. The other resource that I have is the all-inclusive membership. I've got about 25 topics of case studies that you can purchase individually on keithrn.com, but really my best value that they're using at California Baptist University, as well as programs across the country and Canada, is the all-inclusive membership, where I have 110 case studies of different levels of complexity. So the skinny reasoning is my shortest and most concise level of any topic, but then I have an unfolding level called unfolding reasoning that's over twice as long, 8 to 10 pages in length, with higher level advanced reasoning questions with a change of status. And so I just want you to know that I've got that resource as well. More case studies, teaching webinars, and additional clinical tools. Simple one-page handouts to develop that pattern recognition and clinical judgment. I also just want to let you know that if you're not already getting my KeithRN updates, you can do that by just simply downloading that case study on keithrn.com. And I've got a blog that I post every couple weeks. I've got one coming out tomorrow on strengthening the virtual clinical space. And so just some practical strategies to build on what Dr. Jetton has shared, as well as other things that I've developed to really strengthen virtual clinical teaching. So if you get my KeithRN updates, you're in good shape. It'll be in your inbox first thing in the morning. And if you're in my membership, I also have office hours, which is simply 10 to 12 noon Central Time. I'm video conferencing office hours with individual faculty across the country. And I get a handful of educators who just want personal guidance. I'm there for you to strengthen how you teach and help you use the tools successfully inside the membership. So if you're a member, you'll get an email in the morning. Just come on in, join the Zoom link, and I'd love to connect with you there. And finally, next Thursday, we'll be doing a Facebook Live with Dr. Jenna Barton, who is a student advisor at William Carey University, and that's where I got my PhD program. And they have an accelerated PhD program in 2 years. I completed my PhD with my master's in nursing education, and it was very doable. I want to encourage you as an educator, if you've been contemplating getting your doctoral and a PhD as the level you want to pursue, come next week and learn more about really how simple and some of the practical realities of just making that your dream come true and get that doctoral degree and the knowledge that comes with it. And so I want to bring Susan back in and just kind of get a sense as far as, for those of you that are still with us, what basically was your biggest takeaway tonight, and what questions do you have? And so I've got some questions here I'm going to bring in here, Susan, and basically one of the questions here was, what was the second relationship question, please? Well, you know what? I've got that as a caption. So before we get started, I will pop that on the screen for you. And it is that relationship or pattern question. What's the relationship between what clinical data is relevant and why they're there? What's their primary problem? Putting data and the problem together, making that connection. So that is the second question. So for those that wanted that, that is there for you. So anyways, what I've got here, I've got one question here from Tanya, and she says this, Dr. Jetton: I like to record my lecture and then discuss and incorporate case studies. This in activities in breakout rooms. Some students do not like the recorded lecture, I think, because they have to do it on their own. And I don't know if she's just making a statement or if she has a question on that, but do you have any thoughts or insights on that, on what she's communicating?
Well, we do have some recorded lectures occasionally. Usually it's when we have other situations that are requiring us to be some other place, like we have pinning or another activity that's going on during class time. And the students do not like that. They definitely prefer to have the live interaction. And again, I think it's because of the fact that the recorded lecture does not give that interaction that they usually have during the class session. The other thing is, we have had a lot of discussion in our faculty meetings as far as, if we record the lecture, do we have to include that as part of their class time? if they're listening to it, or can we consider that the time that they would be reading as prep time?
Great questions. What'd you decide?
I don't think we came to a consensus.
Okay. 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 So that can be a faculty by faculty or department by departmental decision.
Mm-hmm.
Excellent. You know, this educator had this question. This is from Dee. She said, if you're going to encourage one thing for faculty development, she must be an ER nurse like myself, always prioritizing. What's that one thing for faculty development? What would you select as the thing what have you found most helpful, Dr. Jetton, to just kind of stay current and relevant for you as a faculty over the years?
Well, that's a hard one to answer, because would it be for me with a lot of nursing education experience, or for a lot of new nursing faculty that have
Let's do both. Let's play the devil's advocate, and just basically, if you're a new educator, when you were new, what resources would you commend that you found most helpful?
I would say classroom management and curriculum development.
Okay. Is there any specific books or resources? Like, would you recommend like Teaching Nursing by Billings, or any specific resources that you could steer somebody to who in those topic areas? How would you make that practical?
Well, I would still go back to my original ones that I was saying. Okay. For me, I learned so much from the 7 Laws of Teaching by Howard Hendricks and the 7 Laws of the Learner by
put that book up again.
Well, actually, it's not. I don't even know where I had it. Oh, here it is. This is the old one. This is the
right there, right in front of you there.
Yeah. This is John Milton Gregory, but the ones that I actually learned a lot from was Howard Hendricks and Bruce Wilkinson. Howard Hendricks wrote the 7 Laws of the Teacher, and Bruce Wilkinson wrote the 7 Laws of the Learner. Bruce Wilkinson happened to be the student of Howard Hendricks. Okay. And I didn't learn about this John Milton Gregory until I was doing my doctoral program. And that's when I went back to Howard Hendricks' book and said, did he plagiarize?
Okay.
And realized that he had given credit to this particular author.
Okay. Excellent. No, I think those are, laying a foundation. Those are great resources. I would agree.
Right.
Thanks for sharing. One, Sandy says this, and this is my bad. You have both a DNP and a PhD. How did that come about? Well, that was my bad, because I got her degrees mixed up on my emails. And so she's not only, but she's a DNP doctoral, not a PhD. Is that correct?
That is correct.
All right. Excellent. And so I got one more question here from Tanya. She says, when she comes to lecture, she says, I don't record them all, really just the basic nursing and concepts. So just giving them kind of a concise need to know lecture. And that's kind of, something that I've developed some principles of just that need to know, keep it concise and do it verbally or do it live. But again, you can do it both ways. There's really, I don't think there's a right or wrong. It's kind of what your students are comfortable and what you're comfortable with. Any thoughts on that, or how you kind of skin the cat on that?
No, I think it's, whatever works. If it's working and the students are learning, that's the most important thing. I mean, if your objectives are being met and the students are doing well, and the ultimate goal is to meet your objectives and have the students learn.
Yeah. Amen. And, making more time for active application in the classroom is always a win-win. So the more of that we can do, the better. Excellent. Yeah. Well, listen, there's no other questions coming through the chat. Dr. Jetton, it's been a pleasure.
It has.
Thank you so much for having
thank you.
Being here tonight. And thank you all for watching. And I agree, Tanya, virtual has changed everything. And I think it's really, if I could just share one closing thought, it would be that as nurse educators who some of us struggle to change, this pandemic has forced us to change. And I think that's the silver lining. That as we look at the need to transform how we teach, to strengthen the practice readiness of our students. This is the silver lining, and I hope that we can just continue to change, to innovate, and to be the best. And so our students really graduate with our practice ready, well prepared with the clinical judgment they need. So anyways, we're part of that change. Get your vision, keep your sights set on that vision, and myself is available to continue to help support you to make that reality possible. So thank you again. And Lisa, just in closing, you're saying what school has the 2-year PhD? That's William Carey University in Hattiesburg, Mississippi. And I'll have Dr. Barton, my student advisor, who got me through the 2 years and did a wonderful job. Excited to have her with me next Thursday. So again, thank you so much. Susan, have a great night, and we'll be in touch.
Thank you.
Blessings. Take care.
Bye-bye.
Yeah, bye.